This segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. KATU and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because KATU and Providence Health and Services know that family matters.
Heart disease is a leading cause of death for women in the U.S., but certain pregnancy conditions can double a woman's risk for heart disease later in life. Here to share more, we welcome from Providence Heart Institute, the director of the Women and Heart Disease Program, cardiologist Lori Tam. Good morning, Dr. Tam. How you doing?
Good morning. Thank you for having me.
You bet. Let's talk about what pregnancy-related conditions you're referring to.
Yeah, so gestational hypertension, gestational diabetes, eclampsia, preeclampsia, preterm labor, and a condition where there is weakening of the heart muscle called peripartum cardiomyopathy can all increase your risk of heart disease later in life.
And why do they do that? I mean,
yeah, good question. I think it's, we think that it's the physiologic stressors of pregnancy that brings out individuals that are more susceptible to heart disease in the future.
And so what can be done to prevent this?
Well, women should maintain regular prenatal care throughout their pregnancy. If these conditions are identified, they should work with their doctor closely to make sure it's well managed. In some cases, if you're at risk for preeclampsia, you should discuss with your doctor whether you should start an aspirin for prevention, possibly.
Are there any other things that women can do if they have one of these conditions that you were talking about?
Well, I think it's really important for women to be proactive in identifying and managing their risk factors early, including making sure that their blood pressure, cholesterol, blood sugar are all within appropriate limits, and to also maintain a healthy weight.
Heart attack symptoms are very different for women than for men. So what are some of the symptoms that you've experienced, that you've seen in your patients that maybe surprised you?
Well, sometimes I think women they don't recognize their symptoms of heart disease as easily. And sometimes they really don't describe their discomfort in their chest as chest pain. They're more likely to think of it as a tightness or a pressure or a heaviness. Sometimes they can confuse it with heartburn.
That's what, I've heard that before, confused with heartburn, and take, like you take a Pepto-Bismol to kind of take care of that.
Yeah, I've had patients who have sat at home with a heart attack all night, popped a whole bottle of Tums, and it's made no difference. So I think if the symptoms are really severe, and especially if it worsens with exertion or activity, it's a possible sign that it's related to your heart.
What do you want women to know when it comes to having heart wellness in general? What do you hope that they do?
Well, in general, to maintain optimal heart health, women should remain active throughout their lifespan. They should maintain a diet that consists of lean protein, good fats, the avocados and fish and olive oil and nuts, less in processed foods, less simple carbohydrates, less sugar. Avoid smoking and excessive alcohol, and really maintaining that they're up to date. Maintain that up to date with age-appropriate screenings.
It makes sense. I know that you have a black and white ball coming up, but it's going to be virtual, so that's interesting. Tell me a little bit more about that.
So the Black and White Ball is really the signature fundraising event for the Providence Heart Institute that we do annually. And this year it's being held virtually, but broadcast live out of Providence Park, and benefits the Women's Heart Program so that we can continue to bring important community programs and initiatives to the women in our community.
Dr. Tam, thank you so much. I want to tell everyone, if you'd like to find out more, the Providence Heart Institute is holding a virtual fundraiser on September 28th. The Black and White Ball features a lively auction, special performances, and much more. It's free to attend. To learn more about the event and that benefits the Women's Heart Program, just head to our website and we'll link you. Dr. Tam, thank you.
Thank you.
We'll be right back with more AM Northwest. Don't go away.